Good morning to one and all. I am Dr. Palniappen, MD FICP. I am the Managing Director of Dr. V. Palniappen's Diabetes Specialty Center and Sri Sakti Vinayar Multispecialty Hospital running in Dindigul, Tamil Nadu. I am having a great experience in managing cardio-diabetic patients. I am running one of the top 10 diabetology center in the name of Dr. V. Palniappen's Diabetes Specialty Center. I am a pure cardio-diabetologist. I am doing echocardiography, cardiology as well as diabetology as a complete doctor. I am doing lot of things in my hospital, in my own hospital. I want to share some experience regarding how to prevent various morbidity and mortality in younger chaps, especially middle-aged group. Usually, I want to tell something regarding my own classmate. He is an orthopedician. He died at the age of 40 years because he is a diabetic. He himself, he was not investigated for the cardiac workup. When he fell down while doing shuttle, he fell down. When after that he ignored that symptoms. Then when he is seeing the patient, suddenly collapsed, death. And another doctor, my own, actually 1 year senior to me, is a #1 leading neurosurgeon practicing practicing in Chennai. He also died due to cardio-diabetic syndrome. He also is a very busy neurosurgeon. He used to sleep for 4 hours only. So, these two incidents made me a lot. We have to do something for the middle age group to prevent various sudden death due to the heart attacks. These two people actually they developed heart attack because of not only because of diabetes, because of lack of sleep and tension, depression, all those things provoked the plaque rupture and sudden death. So, even the heart attacks are very common among doctors as well as politicians and police people. So, how to prevent all those heart attacks in younger chaps? So, my cardio-diabetic clinic, actually I am running 50-bedded multi-specialty hospital. Routinely for all patients I won't do. Who are all the risk factors? We should know the risk factors and risk markers. What do you mean by that? These patients you should do type 2 diabetes mellitus patient when the age group is more than 45 years old. All the patients you should screen for, you have to advise them for executive master health checkup. Nothing but taking a resting ECG, echocardiography and treadmill test. ECG normal, 75% heart is okay. ECG plus echo is normal, almost 80% is okay. ECG, echo, TMT is normal, almost 95% heart is okay. Then if you are in suspicious, please submit them for 256 CT multi-slice CT angio. It is costing around just 7,500 rupees. With this, I can able to tell many patients all this TMT, echo, everything is normal. Next 2 years development of you don't have any risk of death due to heart attack, provided you are under control of diabetes, hypertension, obesity and lifestyle modification. Nowadays, that is non-communicable disease. Previously, there are lot of infections causing death. Nowadays, non-communicable disease is the notorious thing that causes the young chap death. After this, that is due to diabetes or hypertension or obesity or dyslipidemia, and after that cancers. If the another thing, I can give a guarantee for the people, next 2 years you don't get any problem if provided you control all those things. I will give a guarantee to them after doing all these tests. Usually when they are common people goes to the doctor, they are charging like anything, they are actually they are charging 5,000 like that. Simply when you are having two-wheeler vehicle costing about 1 lakh, every 3 months they will go for a service for 3,000. For the valuable body, at least once in 2 years, if they undergo executive master health checkup, in my hospital, since 18 years I am practicing in the rural area with the multi-speciality hospital. In that, lot of patient, the outside lab I did, sugar is normal, but many time fasting is fasting. You should take the blood sample at 7:30 exactly. After that, after 2 hours, after giving 84.5 gram of glucose D mixed with 200 ml of water, take a blood sample after 2 hours. That is, once you take while taking the time, you have to note after 2 hours you have to take. Fasting nowadays for Indian population, it should be less than 90 milligram, not 100 milligram. Our Indian population completely different from Western population. Fasting should be less than 90 milligram per deciliter. Postprandial should be less than 140. To diagnose type 2 diabetes mellitus, fasting should be more than or equal to 126 and postprandial more than or equal to 200. Usually the incidence of type 2 diabetes mellitus, it's around 15 to 20%, even rural as well as urban area. But same 15 to 20% people, they are having pre-diabetes. Pre-diabetes much more dangerous than diabetes. Pre-diabetic patient, if it is there, lifestyle therapy including medically assisted weight loss and giving simple metformin. Metformin is a wonderful molecule. It was invented in 1970s, which was well rejected by US people. Nowadays type 2 diabetes mellitus, the topmost priority molecule is metformin, simple 2 rupees molecule. So usually lifestyle modification and including medically assisted weight loss. So you have to detect pre-diabetes and diabetes. Nowadays hypertension, hypertension criteria is dramatically changed. Nowadays hypoglycemia and hypotension is much more dangerous than hyperglycemia and hypertension, because recent criteria, the recording the BP is much more important. In the office, in the clinic, when you are recording the sphygmomanometry, if the BP is more than or equal to 140/90, it is diagnosed as a hypertension. In 3 consecutive reading with rest, with comfortably sitting, without smoking, without intake of alcohol, 3 readings consistently shows more than 140/90, it is hypertension. When the nurse is taking the automatic BP reading, if it is more than 135/85, it is called hypertension. Another newer intervention, 24 hours ambulatory BP monitoring. It is a great thing. If you do at least once in a year, if all hypertensive patients, if you submit them for 24 hours BP monitoring, you can very well diagnose as well as various complications, and you can titrate the antihypertensive therapy. So hypertension, this is the thing. If it is there, please treat. Type 2 diabetes mellitus, this is the diagnostic criteria you have to treat. And obesity nowadays, overweight is very important. According to the BMI, 23.1 to 24.9 is overweight. Usually this you have to take. You have to address pre-diabetes and overweight. This has to be addressed. These are all things, always it's notorious, always dangerous. Many times, many doctors, they will say your weight is okay, belly is okay. Ladies more than weight circumference more than 80 centimeters itself is a metabolic syndrome X. Male more than 90 centimeter waist circumference is a metabolic syndrome X. So hold is a dramatically, it's a hold, it means hypertension, obesity, dyslipidemia and diabetes. These, if it is there, it's well and good. Nowadays common pros, they will tell type 2 diabetes mellitus, once the patients develop, the longevity is less than non-diabetic people when they are not under control. But at the same time, type 2 diabetes mellitus diagnosed on very good control, they will live more than 10 years on compared to other people. They are those who are having obesity, belly. Suppose I am not having any problem, I am eating like anything like that, more than that 10 years, more than that people, they will live, provided type 2 diabetes mellitus is under good control. Many times these 4 things are friends, close friends, they are close friends. You have to investigate. If type 2 diabetes mellitus present, you investigate for hypertension, obesity and dyslipidemia. If anything combination is there, you have to treat as a whole. Recent AACE 2018 guidelines, that is the topmost diabetology guidelines, what they are selling, that is American Association of Clinical Endocrinology Society, what they are telling, type 2 diabetes mellitus management is not simple. When you are treating type 2 diabetes mellitus, whatever the drug you are going to put, it should not produce hypoglycemia, it should not produce weight gain. And when you are selecting the drug, you just analyze what is the cardiac status, what is the renal status, and what is the central nervous system status. According to that, you have to select the drug. Nowadays, 2 molecule is doing wonderful value, that is DPP4 inhibitor, and another thing is SGLT2 inhibitor. So, these 2 molecules are wonderfully they are doing weight loss, that is much more important. When the patient is when the patient is in under good, that is a good BMI, on many times if you are using sulfonylurea, it will produce weight gain. But many patient, in my patient around 25% people, I used to put lifestyle modification including medicative assisted weight loss and maximum dose of metformin and DPP4 inhibitor. If at all necessary, I will add SGLT2 inhibitor without any sulfonylurea, without insulin. These 4 things they are under good glycemic control for more than 15 years without insulin, without sulfonylurea. So, this is very important. So, cardio-diabetic clinic, what I am going to tell is ECG, echo routinely you have to do, and TMT many times in my clinical practice, type 2 diabetes mellitus, ECG echo is normal. When I submit them for TMT, according to my statistics, around 20% it is positivity and 10% they are having mildly positive. If you submit them for 256 CT angio, it is a non-invasive procedure, just giving an injection, taking a 256 multi-slice coronary angio, it is positive. If it is TMT is positive, definitely 70% of the patient 256 CT angio is positive. When there is positive, more than 70% block, submit them for PCA or bypass surgery. Less than that, submit the medical management. Many times they want patient, they believe, they trust the investigation, not the doctor. So, there is a positivity, we can stick on to that diet, lifestyle modification, then they will do wonders. So, in my clinics, many patients, at least per year, at least 5 patients I detect after doing executive master health checkup, prevented death, sudden cardiac death. If it is there 256 CT multi-slice angio, if it is positive, I will send them for that is stenting or bypass surgery. They do very well. So, this is the detection. Which patient you have to do? 5 things is very important. First thing is age group, type 2 diabetes mellitus with age group more than 45 years and associated with hypertension, associated with the high LDL, low HDL, and premature CVD. That is premature CVD means when there is a family history of heart attack or family history of stroke, family history of kidney disease occurring in father less than 55 years, mothers less than 65 years. If there is a morbidity and mortality, these children should undergo all this investigation. And presence of current smoking, it is also important risk factor. If it is there, submit them for executive master health checkup. If it is anything is there, pre-diabetes or obesity or hypertension, treat them adequately. Once in 2 years, they have to be under surveillance, and sugar, once in 3 months HbA1c and blood sugar, within 3 months you can achieve the target. If you do all this investigation for the past, I have mentioned the 2 doctors, under good surveillance, we would have been prevented the death even with our colleagues, own colleagues. They do not bother about their own health. With that, we can prevent heart attacks, because diabetic patient dies, 60 to 75% type 2 diabetes mellitus patient, they die due to heart attack. And in female type 2 diabetes mellitus, in female menstruating female, actually usually menstruating female estrogen progesterone, it protects heart attack. But if they are having type 2 diabetes mellitus, there is no protection. and even type 2 diabetes mellitus patient with the heart attack is silent, pre-hospital death, sudden death and severe attack, recurrent attack is very common. That is why cardio-diabetic clinic establishment is very important, very important. You have to investigate executive master health checkup. Sometimes thyroid, hypothyroidism will be there, and dyslipidemia, that is fatty liver, everything will be there. After that, if you give very good advice and lifestyle modification, all those things, definitely you can prevent young chap death and middle age death. One important point I want to mention, that is there is a family history of heart attack or family history of kidney disease, family history of stroke, please ask them to undergo investigation in the age group of 40 years itself. All those things will prevent various morbidity and mortality. Another two important thing is, usually diabetic patient they ask, can we participate the feast? Yes, you can go, because you have to restrict, nowadays you have to restrict the carbohydrate diet. Carbohydrate diet has to be reduced. Fat you can take 20 to 30%. Protein, we are taking less protein, you can increase the protein. Especially oil, whatever oil you want to take, you can take. But repeatedly cooking will produce trans fatty acid. Nowadays, trans fatty acid is much more dangerous than fat, and carbohydrate content is much more dangerous. These two are notorious thing, will produce heart attacks. Age group more than 45 years and type 2 diabetes mellitus, rule out, hold, and if it is any problem, treat accordingly to prevent morbidity and mortality. If you do treat adequately, you can increase the longevity more than 75 years, definitely they will live more than 75 years. So, controlling diabetes, not only diabetes as well as hypertension and cardiac, all those things will prevent heart attacks. 60 to 75% people dies due to heart attack in type 2 diabetes mellitus. So, all those things, dietary restriction and that is lifestyle modification, including medically assisted weight loss, it's very important. That is a basement. After that, the therapy, hypertension, diabetes, obesity, it's a lifelong therapy, not a short course. You have to continue lifelong. You should not skip the medicine. So, sometimes daily they are under control, one night they won't take the medicine, insulin medicine they won't take, suddenly the blood sugar will go 450, sudden cardiac death can occur after having a full drinks. So, this is called glycemic variability. So, avoid this glycemic variability. If the patient is on metformin and DPP-4 inhibitor, they are very safe, and this glycemic variability has to be avoided. To reduce the glycemic variability, heavy food has to be avoided, daily walking at least 45 to 60 minutes, consistent, that is a brisk walking. First, you should have a brisk walking for 45 minutes. First 20 minutes, usually they will do 20 minutes walking, they will have a cup of tea, again they will walk. 100% it's waste of time, waste of money, because first 20 minutes carbohydrate will be utilized. Next 20 minutes only the fat will be destroyed and utilized for energy. So, continuous brisk walking at least 45 minutes to 60 minutes is a necessary and mandatory to prevent heart attacks. Thank you very much for the interaction.